Hi, thanks for tuning in to today's video spotlight, where we'll be highlighting what is a concussion and the first steps that doctors and patients take when trying to recover from a concussion. My name is Dr. Tony Doran. I'm a neuropsychologist and concussion specialist, and I'll be reviewing those items with you today. So a concussion is caused when the body or the brain are struck violently, causing the head and neck to shake back and forth or twist side to side. This causes the brain to shake violently in the skull, slamming up against the skull. And this causes a neurometabolic cascade, or the brain twisting and tearing the neurons. That neurometabolic cascade, imagine your brain's a sponge with fluid in it, surrounded by fluid. What happens when I throw that sponge against the wall? The fluid in it is going to leak out, and the fluid surrounding the sponge is going to leak in. And that's one of the types of injuries that are caused by a concussion. Concussion usually occurs in the context of normal neuroimaging. So if doctors in the emergency room do a CT or an MRI, that neuroimaging is going to be completely normal. Yet, the patient is still going to have a host of physical, cognitive, emotional, and sleep-related symptoms that can persist for days, weeks, months, and in some cases, even longer than that. So the first step doctors and patients take when a concussion is diagnosed is complete brain rest. And it's just what it sounds like. You're going to completely rest your brain. You're going to go up in your room or a dark room, and you're not going to come out. You're not going to do any emails. You're not going to do any texting. Phones are going to be off. No electronic devices, no laptops, no computers, no TVs, no iPads, no watching TV, no checking out YouTube, no doing emails, no doing schoolwork, no doing work. It's complete and total brain rest. The only thing you're doing is resting, eating, and going to the bathroom for 24 to 48 hours. After that, make sure you check in with a concussion specialist who can help you then navigate your recovery from a concussion. Thanks for tuning in for this brief video spotlight. I'm Dr. Tony Doran, and we'll talk to you soon. Hi. Thanks for joining us for today's video spotlight. I'm Dr. Tony Doran, neuropsychologist and concussion specialist. We'll be talking about steps you can take following a concussion. So great personal self-care can really help you get up and moving again following a head injury and concussion. I like to call it grandma's rules. Do everything your grandma used to tell you to do to stay healthy. Step 1, hydrate. Drink half your body's weight in ounces every day. So if you're 150 pounds, that would be 75 ounces of water daily. You also want to eat healthy. There is no diet in particular that's going to help you recover faster from a concussion. A well-balanced diet, including proteins, starches, fruits and vegetables, are going to help you get back in the game. Your brain is really struggling for sugar and glucose to heal. And sometimes following a concussion, you're nauseous. So spacing out your meals and eating almost snacks 6 to 8 to 10 times a day is going to continue to feed your brain regularly and also keep your glucose levels elevated. The other thing you want to do is listen to your body. Take frequent rest breaks throughout the day. Even if you don't feel like you need one. Every hour, every 45 minutes, every 90 minutes, make sure you step away from the computer, stretch, go for a little walk, grab some water, grab a snack, and then go back to doing what you were doing. Keep activity light. Nothing more than going for walks or a stationary bike. keeping your heart rate down and not elevating it until evaluated by a medical professional and monitored by a medical professional. The last thing is sleep. Our body heals when we're sleeping. Our mind heals when we're sleeping. You want to try and get 7 to 9 hours of sleep regularly. First, using good cognitive behavioral techniques, good sleep hygiene, turning off all electronic devices, not drinking tea or coffee after 6 p.m., making sure the environment's nice and cool, having some white noise on, are all going to help you sleep better in the evening. If you continue to have difficulty sleeping, a little melatonin at night can help initiate sleep and have you stay asleep. So using grandma's rules, good personal care, good hydration, good diet, frequent rest breaks, good sleep, and light physical activity is going to help you get back in the game, get back to work, and get back to your normal level of physical activity. I'm Dr. Tony Doran. Thanks for tuning in today's video spotlight covering what you can do to help yourself recover from a concussion.